listening to Everyday Evidence, presented by the American Occupational Therapy Association, helping the occupational therapy practitioner apply evidence to practice. Here's your host, Matt Brandenburg.
All right, today we are joined by Dr. Denise Donica and Dr. Jana Cason. I want to thank you both so much for taking the time to share your knowledge and expertise with us on the show today. I've been really looking forward to this conversation. Denise, you are professor and chair in the Department of Occupational Therapy at East Carolina University in North Carolina.
Yes.
Jana, you are professor and director of scholarship in the Doctor of Occupational Therapy program Honolulu at Hawaii Pacific University. We're going to be talking about occupational therapy and handwriting telehealth interventions. And I'm just really excited to get to know both of you a little bit and learn from your expertise in this area of occupational therapy practice. And as way of introduction, I wanted to ask what motivated each of you to focus your scholarship on handwriting skills specifically?
Thank you so much, Matt. I will start. I have had an interest in handwriting skills for many years, based on my years in clinical practice, both in outpatient pediatrics and school system practice. So handwriting was a skill that was often affected by the children that I treated, and I focused my own professional development to improve my knowledge of handwriting assessment and intervention. When I transitioned after that into academia, handwriting continued to be an interest of mine, which I explored for research. After telehealth became part of the occupational therapy education standards many years ago, I believe it was the 2011 standards, I decided to get some experience myself through telehealth so that it would make me a better teacher about telehealth practice. So I had a small caseload of children that I treated, and they all had handwriting challenges. So that's where I got the bulk of my experience. But then later, during the COVID-19 pandemic, I decided to focus my research on addressing handwriting skills through telehealth because children weren't able to receive services in person at that time. And then more recently, I've begun exploring the relationship between sensory integration and handwriting skills in the elementary students. Now, Jana's had a little bit different journey. So Jana, tell us about your journey.
Yeah, so my scholarship is primarily focused on telehealth and has encompassed many skills and settings, including a focus on handwriting. And I was driven to pursue this area of scholarship because I saw firsthand the challenges with provider shortages and access barriers in my own practice. And so through telehealth, I've worked with children from early intervention through school age, and I find OT practice with this service delivery model just very rewarding. So I'm excited to have the conversation today and share a little bit about our experiences.
Absolutely. I'm excited to learn from you both. And I think it's really encouraging and inspiring to hear how your research interest in this area related to handwriting and telehealth stemmed from identifying barriers in your own personal practice and being creative and problem solving ways to overcome those barriers and provide quality care to the people that you work with. Why do you feel it's important for occupational therapy professionals to understand and be comfortable with telehealth as a method of service delivery?
I think there are many aspects of occupational therapy that can effectively be delivered through telehealth. There has been research that's been out actually for several years that has supported occupational therapy through telehealth, both with the pediatric population as well as the adult populations. That research started prior to the pandemic, actually, but there's been a lot of additional research since then that has surfaced. In addition, with the establishment of the Occupational Therapy Licensure Compact that is expected to start issuing compact privileges in 2025, occupational therapy practitioners will have the ability to have a compact privilege to practice across state lines. So as of today, 31 states have enacted legislation to be part of this compact. The implementation of this licensure compact will make it less cumbersome for occupational therapy practitioners to have those privileges to practice in multiple states, which will be a great asset for telehealth practice.
Yeah, to build on Denise's comment, I agree. It's absolutely a tool that we can use in our toolbox. It's a very important tool that really can help improve access to OT services. Some listeners may be surprised to learn that AOTA has had a position paper related to telehealth going all the way back to 2005. So a really long time. And over the years, they've had many resources to help support its use and its integration into OT practice. So many practitioners and clients really got the chance to see the benefits of telehealth firsthand during the COVID-19 pandemic. And while there's been evidence going back many, many decades, we've just seen a tremendous growth, as Denise alluded to, since the COVID-19 pandemic, and just increased interest in telehealth as a service delivery model in OT. And I've been an early advocate for telehealth, but I always think it's important that we mention that it's not a blanket approach. And so it's not going to be the right fit for all practitioners, and it's not a right fit for all of our clients. So we really want to be thoughtful about that and really look at ourselves and reflect. But I've always said that with occupational therapy, there's so much that we do about looking at the task and the environment and really supporting our clients that don't require us to be physically in person with the clients. And so we really can do so much through telehealth.
Very well said. Telehealth is, like you mentioned, growing exponentially. I think it's important for all practitioners at this point to have a foundational understanding of its approach and be ready with some telehealth interventions and options in our toolbox, or even to base a majority of their practice in telehealth. That's what's wonderful about occupational therapy is it encourages this type of creative application of approaches and treatment. I want to catch all of us up on handwriting and how it affects a child, how it affects a family, how you really approach your care with some foundational knowledge questions. So what would you say is really the impact of handwriting difficulties on children?
I think that's a great question, and I think it can stem some controversy in our age right now because of the introduction of so much technology in education. There have been a lot of questions as to whether handwriting really has a role, and I am very encouraged to see that even current research talks about the role of handwriting in academic success, and it is very well supported in research. There is a strong connection between handwriting and overall academic performance and spelling, reading, composition, and writing tasks. So handwriting skills are foundational to many of the educational requirements in school, and they continue to be required in educational standards across the country, especially early learning standards.
Yeah, and to build on that, in addition to just the academic success, I think for me, it really resonates that difficulties with handwriting can have a negative effect on the emotional well-being of the kids that we see. So, affecting their self-esteem, their self-concept, and even their grades. Interestingly, there's some research that shows teachers may score the same content lower due to just an unconscious bias towards messy handwriting. So I think that that's just really interesting. So really that self-esteem component, the emotional well-being, in addition to the academic success is, critical when we're thinking about working with children with handwriting difficulties.
Absolutely. It's important to consider handwriting as an occupation and to consider all the person environments and, performance factors that go into the performance of handwriting as an occupation. And especially those ones that tie to self-esteem that's so vital to child development. And perspective and attitude. I'm already learning so much from both of you. What are some of the most common therapeutic practice-based handwriting interventions? And would you say most handwriting interventions are curriculum or manual-based?
I often use practice-based techniques such as tracing letters with chalk, writing letters in shaving cream, making letters out of dough, lots of things like that in my treatment sessions. However, students often need foundational skills before they can build or write letters. So I learned to look developmentally and help children build letter recognition skills, in addition to fine motor coordination skills and visual perceptual skills through motivating play-based activities that relate to handwriting skills. It's important to understand the interests of the child and the expectations of the teacher and parents in order to individualize treatment to address not only handwriting skills, but also their other needs. So when I began working clinically with students, after I transitioned from adult practice, one of my priorities was to attend professional development courses on handwriting skills because I knew that this was going to be a need of many of the children and students on my caseload. So many of the techniques that I used were based on these training sessions, and they have stemmed from curriculum developed by occupational therapists. So some programs developed by OTs include Handwriting Without Tears by Jan Olson, which was developed for handwriting readiness, print, and cursive skills, Size Matters handwriting program for printing by Beverly Moskowitz, and Loops and Other Groups for cursive writing by Mary Bimbo. There are other materials developed by occupational therapists as well to support handwriting skills, and more continue to be developed every day. So to answer your question, I do often combine practice-based techniques and curriculum-based techniques to address the individual needs and interests of the child.
Like Denise, I also sought out professional development related to handwriting evaluations and interventions. And I also gravitated and found a handwriting curriculum that I really liked and used, and then incorporated manual interventions along with that to target foundational skills like, fine motor skills, hand strength, visual perceptual, visual motor skills, and then ultimately kind of integrating that into my telehealth practice and just adapting to support that practice.
Absolutely. And you both mentioned the importance of, tailoring the intervention to the skills of the client, of the child in this case. How does that dynamic change in telehealth? Would you say it's, the same process to tailor your interventions to the needs of children? Or how do you really emphasize that while providing services through telehealth?
Sure. I think there are some things that are similar and some things that are different from in-person services. Occupational therapy prides itself on using approaches that are client-centered, as you mentioned, and as Jana and I have both referred to already. So this is really where our profession's creativity and the art and science of our practice shines. So although we may use the same activities and the same materials in a variety of different treatments with different children, how we adapt to each child is critical. So handwriting interventions through telehealth offers us the opportunity to use both manipulative-based and digital-based activities within the sessions. Handwriting intervention can actually be expanded through the use of telehealth. So when conducting intervention through telehealth, I was much more inclined to use technology to assist with the intervention, such as using the Learning Without Tears digital tools that embed web-based demonstrations of letter formation so that the child could clearly see it on the screen, versus sometimes if I try to demonstrate it through the camera, it might not be as clear to them. I learned about the web platform too that I was using and how that could enhance my session, such as the way I could annotate or even share that annotation option with the child so that they could annotate on the screen share features, and as I mentioned, just sharing the control options so that we could engage in collaborative activities on the screen. And so one example of that is doing a word search activity for letter recognition and scanning skills where we could each circle or highlight words on the screen. In addition, I would gather information about commonly used materials that the child and family had available in the home so that I knew what I could incorporate into the session easily. And I typically gathered this after the evaluation by a survey that I would send to the parent. And then I would inform the parent prior to each session what materials would be needed for that session. So using materials that the child has in the home already and involving involving the parent directly in that preparation and sometimes in the actual session can assist them in carryover of these new skills.
That's been my experience of many of the things that I do in person. I would also do those same activities through telehealth. There were a few key differences in how the intervention is facilitated. So for me, with younger children, I found it's important to have an e-helper that might be in the home, a caregiver, a parent. At school, it might be a paraprofessional. And that person can really help assist with the setup of the technology, making sure that the camera angle is appropriate, managing the materials, and really helping to just facilitate the transitions between activities. And another thing that I always like to try to think about when I'm doing my sessions with children is just the environment they're in. So if we're going to be working on tabletop activities, or particularly with handwriting, that they're seated in a chair at a table or desk, their feet are supported on the floor, that sort of thing. And then also, as Denise mentioned, it's important to think about those materials. So you really have to be mindful in planning the session out and what do you need, and to communicate that with the caregiver, whether that's paper, pencils, crayon, or other fine motor manipulatives that you're planning to incorporate into the session. The camera placement is a really important consideration. So in thinking about what's different with telehealth, so even just thinking about if they're using a computer and it has a built-in camera, you really are limited at what angles. It's good for conversation, but you really can't angle it down to see the tabletop surface or the handwriting samples and so forth. So thinking about that piece, thankfully, many families, smartphones and electronic tablets like iPads are really common now. And so that makes it a little bit easier because we can use one of those types of devices as a secondary camera to be able to capture some of those different angles. And then even with like a laptop, I've had children who have only had access to a laptop, and that works pretty well. You just have to slide it forward and tilt the camera angle down to be able to see that tabletop surface, and then kind of shift the screen back up to have some conversation. So sometimes you have to be creative with what the family has available to them, but certainly the more use that we have with mobile devices, that certainly makes it easier to think about the camera and using mobile devices as a second camera to really capture those angles that we need to see. And then just the last thing that I've found is really important is just a stable internet connection. The family on their end, as well as you as a provider. Sometimes the screen might freeze. And so I had to get really comfortable with being okay with that and just telling the child to continue working if we freeze, and we usually reconnect pretty quickly. Just some of those technical issues may come up. And just in my experience, though, it's very rare that it really has a negative impact or really significantly impacts the session. And you kind of roll with it and continue forward. And it works really well.
Absolutely. Thank you for those recommendations. Those are excellent tips. Telehealth is growing so much, and this is such a wonderful service for practitioners to be able to provide. Some practitioners may be a little skeptical or a little intimidated to step into providing telehealth services because of all these digital tools and, learning these new systems and a new, way to deliver care that's different than what they may be accustomed to. What would you recommend to them to really get comfortable using these digital tools? And is there anything you'd recommend to kind of facilitate the transition into providing services this way?
Yeah, I think that, certainly there are digital tools. And as we mentioned, it's really a way to complement what we're doing with our fine motor manipulatives and handwriting workbooks and practice. And so really thinking of the digital tools as that, as a complement. So, there are some great resources for animation of letter formation or, other things that we can do. But at the same time, I just think it's important to also think about our interventions that we do in person, and these generally do translate really well through telehealth. And so, we've talked about it's important to think about that, the materials they have available and the environment that they have, but, also being creative and seeing, thinking about what can we do to really make those engaging sessions and to really interact with that child and to use some of those built-in features that are available within those platforms. One resource that I think some practitioners might find helpful, there's some really nice YouTube channels, and we can share some of those in the show notes. I was part of helping to develop Telehealth Share during the COVID-19 pandemic, which has a YouTube channel that just provides ideas for therapists for sessions. And one of the most popular ones was an entire OT session with just paper. So, sometimes materials can be a challenge. And so just creative ways. In this particular instance, it was a therapist demonstrating what she does with a client, with a child, and engaging that child with just a piece of paper, tearing and folding and rolling it and playing some games with the little balls that they've created, and, isolating the finger and flicking the balls. And so I think that sometimes just having some resources to help you think, what could I do, and what does this look like, and how does this work through technology, can be really helpful. So there are some of those available. And then, as Denise mentioned, just really getting familiar with what's built into the platform. So we do tend to incorporate some of those digital tools like annotation feature or screen sharing, and doing some things on the computer, as well as some of those more traditional in-person interventions. So just practicing and getting familiar and feeling more confident, I think, is a really great place to start.
Thank you, Jana. Those are some really great points. I know one of the resources that I would mention too is a research study that I did with one of my colleagues here at East Carolina and some of our graduate students during the pandemic. And this is a study that's published in the Open Journal of Occupational Therapy. And it really looked at two different platforms and the use of those platforms to deliver handwriting interventions. So it talks about some of the features, some of the benefits of using those platforms, and the parents' perception of that. So that may be helpful for people who are getting ready to transition and want to think about what do I need to consider when learning these different platforms and what might be beneficial to me. Of course, there's many more than just two platforms, but those are the two that we used. Another comment that I wanted to make about digital tools in terms of intervention is just to reinforce what Jana was sharing, and it really is important for occupational therapy practitioners to remember the importance of using those paper-based activities and manipulatives to address both the foundational skills for handwriting as well as handwriting itself, and not just relying solely on apps, on tablets and digital resources. The digital tool should be a supplement, but not the entire intervention when addressing handwriting skills.
Absolutely. Thank you so much for those recommendations. How does providing telehealth services encourage increased family involvement and carryover of progress with the children you work with?
With telehealth services, as Jana mentioned before, it is important to have an e-helper or someone to assist in the process who can help gather materials and help the child stay focused on the task at hand. By doing those things, they are watching what you are doing and seeing the child's response to that. So this gives the family additional ideas for what they can do when you're not with them. For older children, they may not have an e-helper assisting with the session. And it's really awesome when these older children develop that internal motivation to generalize their skills to other settings. So one of the children that I treated was really struggling with her grasp, which had negatively impacted her handwriting skills. She was in third grade, which is typically thought to be too late to change grasp. But we worked through our sessions to find a grasp pattern that worked well for her. And then I had encouraged her to try to use that grasp at school during her spelling tests. She said she would sometimes when we would come to the sessions, she would report that she was using that grasp at school during her spelling test time. And then one day she came to our session and she was so excited to tell me that she had actually used that grasp the entire day at school. And so that wasn't with me. I didn't have to cue her to do that. The teacher wasn't cueing her to do that. That is something that she had decided that grasp really helped her, and she wanted to use that all day. And this was a really great story of success. And she continued to integrate that grasp, and actually not too long after that was discharged from services with me because she had improved her handwriting so much. Jana, you have any other ideas?
Yeah, I've just in my own experience with telehealth have seen some really, really great carryover with families. As Denise mentioned, a lot of times if it's with the younger children, the caregiver's there and involved in the session. And I have just seen that that's naturally helped to lead to some good carryover and progress. One of the most rewarding things for me was just hearing from practitioners during the pandemic, because I had been doing telehealth for many years prior. I was able to connect with a lot of practitioners who were reaching out, and some of them shared stories, and they were just amazed at the progress they were seeing with clients that they had worked with oftentimes for quite a while. And then when they started using the telehealth and incorporating some family and carryover components, just really seeing some tremendous progress. And we're really excited about that. So in my own practice, I try to come up with functional ways that the child and family can work on the skills that we're targeting during the session. I think that's just true of all occupational therapists, but whether we're serving children in person or through telehealth. So for example, with telehealth handwriting focus, I might have the child helping the parent write a grocery list. So during the week, as things come up, they can add to the grocery list. And that's just kind of a functional way to practice the writing. I've had children that have written a letter to a family member, to a grandparent, and they always excitedly share with me a little bit about that, if they've done that in the previous week from our session. And then just customizing some worksheets so the kids can work on their spelling words. So trying to make it meaningful and giving them an opportunity to practice. And so some of those strategies have really worked well to promote some carryover and some practice outside of our sessions.
Those are wonderful examples, and it's clear to see the positive outcome that came through your approaches. I think sometimes it can be difficult in practice to really find that best fit and the just right challenge during intervention. And I'd love to get a sneak peek at each of your kind of clinical reasoning of how to find that, best fit and achieve that, maximum potential positive outcome that a client can reach. How would you say a therapist can use clinical reasoning to determine what telehealth handwriting interventions are appropriate and best suited to a specific child and their environment?
So that is a really great question, and it's really important to consider in general if using telehealth to address handwriting skills will work for a child. And there are a few factors that are really great to consider when looking at this as an option. First, it's important to consider how much physical assistance might be needed for a child with their handwriting skills. And if there's an e-helper available to assist with those techniques, such as hand-over-hand assist, or to physically adjust pencil grasp for the child if necessary. Secondly, if assistance is needed, can that e-helper or caregiver be trained to provide that level of assistance? That's an important thing to think about. Third, and a really important one in my experience, is consideration of the attention, to be able for the child to focus on the task at hand while using the device to be able to engage in the session through telehealth. So, for example, in one of my research studies using telehealth for handwriting skills, we had a small group format that we were using, and we had a child who was easily distracted. And he had changed his background to be an astronaut in space. And while we were all doing animal poses as a warm-up, he was pretending that he was floating around in space. So that was a little bit of a challenge. He didn't have an e-helper helping him. Although that may not have been the best medium for this child to receive occupational therapy services for handwriting skills, this was during the pandemic. And so we were not able to offer our handwriting program in person. So for him, telehealth was the only way that he had access. In addition to handwriting, I've also worked on keyboarding skills through telehealth, and this was also done with an e-helper who was a student's assistant at school. And so in this situation, we set up the keyboarding portion of the intervention where they were sharing his screen with me so that I could see what the child was typing, and then they had the camera angled so that I could see his hands while he was manipulating the keyboard. And so that worked out really well for that particular setting. Jana, what other ideas do you have?
I definitely want to just reiterate the importance of clinical reasoning and thinking about, is it a good fit, and looking at some of those different factors that Denise mentioned. And, it's not a blanket approach that it's right for all children. And as mentioned, sometimes attention span or having ability to have somebody there to help if that's a need goes into that decision. But I also think it's really important just to reiterate that it's such an important model to help overcome barriers to access. And so, there may be times that it maybe isn't our preferred method, but it's the only way that child might get services. And then, in that case, with looking at is that going to provide some benefits to that child, and what can you do through telehealth to help support that child's needs? So I think that just reiterating the importance of using good clinical reasoning to determine if it's a good fit is really important.
Absolutely. These recommendations are so helpful, so valuable. Let's talk a little bit about assessment. When you're beginning to initiate services and you want to assess a child's current, ability for performing handwriting, other factors that may be impacting their performance, how do you deliver assessments through telehealth to kind of get started?
That's a great question. Yeah, there's definitely a really nice growing body of evidence that is looking at reliability and validity of some of our common OT assessments to be administered through telehealth. And it's also exciting to see some of the publishers. So like Pearson and Western Psychological Services, or WPS, they are providing practitioners with guidance and best practices for administering some of their assessments through telehealth. We can provide a link to some of those resources in the show notes. And, even one to think about, like Pearson provides resources to support Beery VMI, which is really commonly used in practice to be administered through telehealth. So variety of assessments. I think that we're going to be seeing more and more publishers looking to digitize and make some of the stimulus workbooks and different resources that go along with some of the assessments more amenable to a telehealth service delivery model. I think one of the considerations and one of the limitations that has impacted some of the publishers with some of these assessments being available is thinking about what is available on the child's end. So the screen size, if they're using a smartphone versus a desktop computer, some of those pieces will change the dynamics of that assessment experience. So when we're thinking about some assessments are going to translate better to telehealth than others. I personally have used the Handwriting Without Tears print tools. I also commonly use the sensory processing measure administered through telehealth, and that actually has a way to do that very easily through telehealth electronically. So those are two that I use. Denise, I think you've used the Handwriting Without Tears print tool as well as some others, right?
Yes, Jana, I have used the print tool most commonly to evaluate children's handwriting through telehealth. One reason that I chose this tool is that it's only 1 to 2 pages that the child is writing on, depending on their age. This assessment gathers their ability to print all of the capital letters, numbers 1 through 10, and lowercase letters from dictation. So it gives a nice sample of their printing. In addition, since the print tool is not standardized, there's not concern of trying to adhere to a specific standardized administration protocol through telehealth. So it is easier to manage, and that has been a good way for me to capture their actual handwriting ability. Another tool that I've used is called Here's How I Write, and I've used this to gather additional information about the child's perception of their own writing and their priorities. So this is a series of 24 sets of cards where you show them 2 options per skill, and then they choose which best represents them. So this can be done in person, or it can easily be done virtually too. For example, they may choose between these 2 cards. One says, other people have trouble reading and understanding what I write. The other card says, other people can read and understand what I write. So in the end, they select what they want to work on. Sometimes their perception does not match their actual handwriting performance, but it is a nice way to learn about the child's view. In addition, although not specific to handwriting, I would also use the electronic version of the sensory profile too, much like Jana mentioned with the sensory processing measure. And I did that in order to gather some additional information from the parent about how that child is processing sensory input to aid in treatment planning.
Well, you two are doing a wonderful job at illustrating the process and importance of selecting appropriate assessment materials while also tailoring and personalizing even and then during the assessment step to the needs and ability level of the child. In your experience, would you say that you've observed differences in kind of the assessment process or scoring process when conducting a handwriting assessment through telehealth? Or is it pretty similar to an in-person assessment?
Absolutely. There are definitely some differences to be considered when administering an assessment through telehealth. First, we have to consider the materials used during the assessment. Of course, you need to follow the copyright laws for the assessment, and thus you may need to try to contact the author, the publisher, to get permission to send that form to the family virtually, if that's the way that you have access. Another option is mailing the original forms directly to the family. Although this takes extra time and planning, this way you know that form is scaled correctly to the correct size and dimensions. Mailing it back is also ideal for size and scale if you have the ability to do this. However, it may not always get back to you. So a good idea is have the family scan it and email you a copy before they put it in the mail. So that way, at least you have a digital copy if something happens to that form. Another consideration is communication about expectations with the family prior to the session. You'll need to communicate what materials the child will need to have available, where the child should be seated, and their desired posture. You'll also need to communicate about their computer setup and determine how the camera will need to be positioned during the evaluation, much like Jana mentioned before. We have mentioned some assessments that we have used in the past through telehealth and some considerations when making those decisions. But assessments continue to be developed, and there will be many additional options out there, even now, since our experiences with telehealth.
Yeah, I think it's just important to go to the publisher's, webpage and check out the resources they have around specific assessments. A lot of times now you're going to start to see where they do offer it in print form and or electronic form, which makes it a little bit easier to use through telehealth with the electronic options. So I would say the best guidance is just to go to those publishers' resources, to follow the test protocols. Again, if it's a normed-based test comparing against peers, that may be factored into that with the telehealth administration. But if it's not, then, to understand that impacts your ability to interpret that. And you can't compare the scores if you've altered the way that the assessment's been administered or altered the protocol. So I think just following the publisher's guidelines is most important. And then, as Denise mentioned, that just copyright laws. We can't, make copies or take screenshots and digitize materials that have not gotten explicit permission from publishers to do that. So that's a really important consideration when using assessments through telehealth.
Absolutely. That's such an important consideration. One, I, without speaking to you, would have never even considered myself. What are some other best practices for handwriting assessment and intervention through telehealth that you would recommend to listeners?
A few have already been highlighted. So really thinking about having that e-helper available, particularly with younger children. Denise just mentioned the position of the child, the position of the camera is really important. To be able, if you think about with the handwriting piece, even just being able to see how that child's forming the letters and, where are they starting on the paper and what is the stroke sequence. So some of those considerations go into play. Also really that communication piece with that child's caregiver about the materials that they need during the session or for the evaluation. I like to encourage families to just have a little container, a basket or something where they can put the materials and keep them together. So when we do our sessions, they're not having to go look for materials. And again, communicating ahead of time helps with that as well. But even just keeping paper and pencils and some common manipulatives in a container near where they do the sessions can be really helpful. And I like to do, I think Denise mentioned she does a survey to see what materials the family has. I like to use a scavenger hunt right after the evaluation. I'll have the child go look for, kind of have a list of some common household items that I can incorporate easily into intervention activities, and then have them do a little scavenger hunt. And that's always like a fun way the child can go about and find the different things, or come back to the next session and show me the different things they found around their house that are on the scavenger list, but also are things that we can use in our therapy session.
Those are all very important considerations. Another intervention strategy that I know both of us have used is to create a visual schedule for the treatment session using PowerPoint or something similar, so the child's able to know the plan and potentially even check off the items during the session. Regarding the handwriting assessment itself, this is not easy through telehealth because we generally are seeing the child write upside down and even backwards from our view. Whereas when we assess a child in person, we typically sit right beside them so that we see what they are writing in the same orientation that they do. So it is very important to be able to watch a child write in this way and quickly identify if the child is starting in the correct place and making the correct sequence of strokes. So during both assessment and intervention, I often have them hold up their paper in the camera while I take a screenshot if I have permission to do so from the family. And that gives me that snapshot in time to look at later and possibly even use in their note. And it can be a third backup to be able to score if it's an assessment if I don't get a digital version. But they are usually very excited to hold up their work and show off what they have done, and usually see their little face poking around their sheet there as well.
Yeah, that's wonderful. I love how much fun you can have while providing this type of intervention. I think there's so much potential for telehealth to grow. I think it's going to be convenient for families and for children to participate in telehealth interventions. With that said, though, there's barriers and obstacles with any intervention approach. What would you say are some barriers to telehealth service delivery specifically? And how could occupational therapy practitioners contribute to the overall system's improvement?
Question. I would say, in my experience, and I've been an advocate of telehealth now for well over a decade, a lot of times it was attitudinal barriers of just helping both practitioners, but also our clients thinking outside of the box of how telehealth fits into occupational therapy and how it can benefit our clients. I think now we're over that hump where so many practitioners have experienced telehealth due to the COVID-19 pandemic and have seen firsthand the benefits. So I think that one of the key barriers still that we have to overcome or continue to address is just that payment and reimbursement piece so that we can continue to use it as a tool in our toolbox and to make sure that insurance companies and other payers are supportive of using us using telehealth in practice. Another piece is just that rate equity so that the payment is equitable to what is paid for in-person services or there's parity there, because if telehealth is disincentivized and it's not reimbursed well, then it's going to be that practitioners are less inclined to use it, even if it is a great model that's going to benefit their client or create the access for that client. So I think there's still tremendous advocacy we need to do around the payment piece to assure that it's a tool that we can continue to use going forward.
Yes, Jana, those are really important things that we have all been working to try to advocate for over the last several years. And currently in legislation is something called the Expanded Telehealth Access Act. And so during the COVID-19 pandemic, there were waivers that allowed occupational therapy services to be delivered through telehealth and be eligible for reimbursement. But while these waivers have been instrumental in providing access to care over the last few years, they are waivers, and there will be an end to these, which many of them are set to end this year. The Expanded Telehealth Access Act would eliminate the need for the waivers because it would permanently add occupational therapy practitioners as well as physical therapists and speech-language pathologists to a list for Medicare of telehealth providers. And we know from history that many insurances tend to follow Medicare's lead in terms of their policies. So hopefully if this would be enacted, then that would trickle down to additional insurances as well. So we have identified AOTA has a telehealth advocacy resource link that we'll share with you all, where you can find out more information about this, and you can actually go on the legislative action site and write to your legislators on behalf of telehealth.
Absolutely. We'll encourage all our listeners to check that out and investigate some of these resources and contribute as well to the advocacy efforts for such a valuable service. I want to ask about some of the specific interventions that each of you have used to remediate handwriting through telehealth. And if you'd share some examples that maybe were memorable or impactful that you've encountered while providing those interventions.
As I mentioned, I think that a lot of the interventions that I use in person for handwriting translate really well through telehealth. So a lot of the fine motor manipulatives to work on some of those foundational skills. The handwriting practice, as I mentioned, I tend to use a curriculum and it has a workbook to work on. And so the child has access to that workbook on their end. And then I also have a copy on my end. And I do like to use the PowerPoint or Google Slides kind of as a flow of our session. I found that I started to do that early on and found it really helpful. So it usually would be, a warm up activity for the body and for the hands, and then transitioning into some fine motor, targeting some foundational skills, and then some handwriting practice. And then like a little free choice activity at the end that's therapeutic, but also something the child can look forward to during the session. So that's kind of the structure of the sessions that I typically will follow. And then one memorable thing that I thought I was going to share thinking about this was a little boy I was working with who was 9. And it looked like our audio had somehow gotten disconnected. I could see his mouth moving, but I couldn't hear anything. So I'm quickly getting ready to go into troubleshooting mode and figure it out. And then all of a sudden I hear him laughing. And of course I can hear him. So I realized he was just mouthing the words in John's picture, which was hilarious. I mean, he was having so much fun. So it was just a memorable and funny moment. And I think that it kind of just speaks to the therapeutic relationship and just really, being able to see those kids' personalities through telehealth and how that still happens even when we're not in person, that telehealth is a really powerful modality. So anyways, it was just a fun experience and fun to see the kids' personalities and also just the positive impact of occupational therapy through telehealth.
So I'll piggyback on Jana, and I had to chuckle because when I'm thinking about memorable and impactful moments, definitely the impactful are different from the memorable for similar reasons. So one of my favorite activities that I did that was very impactful was working with a second grader, and we were using one of the workbooks from Handwriting Without Tears. And she noticed in the front of the book that there is a handwritten letter from Miss Jan, the author of the curriculum, to the child who's using the book. And so she had read this letter and she decided she wanted to write a letter to Miss Jan. And so the child told me what she wanted to say, and I created a worksheet for her to copy. And she copied that letter, and I have actually for several years worked part-time for Learning Without Tears, and I do some of their professional development courses, and actually know Jan personally. So I sent her the letter, and she wrote the child back, and that whole experience was so meaningful for her, and she had no idea she was going to get a letter back from Jan, but that was really exciting for her. So that was one of the memorable and impactful both experiences that I've had. And another one that I was going to mention, I was working with a child who I was actually working with he was at school during the session, and his assistant was his e-helper. And he had a really hard time regulating to be able to engage in school activities. And so I was able to teach him concepts from How Does Your Engine Run by occupational therapists Mary Sue Williams and Sherry Schellenberger. And this allowed him to communicate about his current level of regulation and identify appropriate ways to adjust his regulation in that school environment so that his engine was running just right for the activities at hand. So those are a couple of specific examples. Some more general activities that I've used have been chalk writing, reciting steps to form the letters, practicing different grasps, word searches, like I mentioned before, on the computer, memory activities, of course, using a handwriting workbook, and other activities with pincer grasp. But if I think about some other memorable moments that I always share with my students and others that are wanting to try out telehealth, I had a memorable story of a child who was a little bit younger than Jana's. She was actually about 5 at the time and should have had an e-helper, but her family, there were 4 children in the family, and she was actually the second oldest. And the mother was the only other adult in the house or the only adult in the house at the time. So she was a little busy with the other children. And so she didn't really have the opportunity to have an e-helper. And so one day we were working on some handwriting tasks, and she would purposely get up and move to another part of the room out of the view of the camera. And then I would hear her giggle, and then she'd come back, and then she would do something, and she'd move, and I'd hear her giggle. And then all of a sudden, she shut the laptop. Well, in telehealth, that ends your session. So that session was over for the day. I had another session with the same child, and I was trying to get her to write some words on a piece of paper. And as you can see, she had some spunk in her personality, and she did not want to write that day. So she moved the paper out of the way and decided to write on the table instead. So I was like, yeah, I went with it. She was in her game room, and that table already had some paint markings and markings on it, and she was using a pencil, so I knew it would clean up easily. But when I started cueing her on the table, she did anything I asked her to do, and she was very compliant in doing the activities at hand. This is a great example to make sure you know your families and know the parameters of what materials can be used in the sessions and how.
Yeah, those are such wonderful examples. And I love how it all highlights the importance of having a structure, of having a planned intervention, but also allowing room for creativity and allowing room for fun. Because that's what's going to lead to some impactful moments and some sustained carryover of progress. Thank you so much for sharing all this information with us. Do either of you have additional examples you'd like to share of how implementing a handwriting intervention led to a positive outcome to additional children and their families or e-helpers?
I mentioned before about the one child that I worked with, her grasp. And for that child, her grasp really did impact her legibility. And we had tried a few different things. And once she found the one that worked, she integrated that well. And again, her teachers, her parents both noticed the improvements. And so I was able to discharge her with all of her goals met. And the family was so pleased with her progress that they wanted me to evaluate the younger brother, who was also showing some handwriting challenges. So I actually did pick him up for on my caseload for a little bit as well.
Yeah. And for me, just going back to the importance of handwriting interventions and the impact of handwriting difficulties on emotional well-being, like self-esteem, and as well as academic performance, I've had a number of rewarding moments where I've seen kids just gain their confidence. I mean, that's just so powerful. And I've had many children who've also worked with me through telehealth, and I've never met them in person. And despite that, we formed that really strong therapeutic relationship. And I can just see firsthand that positive impact of OT and how it's improved their self-esteem and their confidence. And, just the families really report back that it's really helped that child tremendously. So very rewarding and not uncommon to see that.
I love that. I love that. We've mentioned so many resources and recommendations for our listeners. Is there anything additional that you'd like to recommend related to handwriting and telehealth for OT practitioners out there?
I would say we haven't talked about AOTA specifically, the telehealth position paper. So there is a telehealth position paper and ethics advisory opinion. So I think, before diving into specifically focusing around handwriting, just understanding telehealth and some of the different components of that in practice and looking at those AOTA resources. And then as it relates to doing assessments, really going to the publishers and seeing what resources they have available to provide guidance and support. And then, for creativity and ideas, there are some amazing YouTube channels and social media pages out there where you can really learn from other practitioners that are doing telehealth and getting ideas and sharing ideas. So I think that that's a great avenue as well. And again, we can share some of those links in the show notes.
And I think in addition to those really important resources, it's important to think about how you are going to transition to this type of practice. And I know it's important to make a list of common materials in the home and just find out what the family has available. They may be willing to purchase additional materials such as pencil grips or things like that. I've also heard there are some other therapists who may have a therapy toolbox that they send to the child when they start telehealth with them to make sure that there's certain things that they want them to have. However you do it, make sure that you have thought about several ways to use those items to benefit handwriting skills. So with telehealth, you can't just grab something out of your own bag and use it. So the creativity and flexibility to use what they have present is critical. You may even want to practice listing all of the things you can think of to do with some common items. Also, make sure you have plenty of time in preparation to plan your sessions. So coming from pediatric practice in person, I was not personally prepared for this initially. I was used to the child taking the lead with me then adapting activities based on the toys that they wanted to use that day. However, with telehealth, I always wanted to have a visual plan for the day with the PowerPoint that took time to prepare ahead of time. And I also had to bookmark commonly used websites, make sure that I knew how to use my tools for the platform that I was using. And I would also email the family a day in advance to tell them the plan for the day and the materials needed. So all of those things were additional time that I had not expected and I was not used to coming from in-person services.
I will just say, though, you do get faster in some of the planning pieces and get processes in place and some established resources you use. So while it is initially a bit of an adjustment, certainly it gets a little bit more easier and a little bit more of a rhythm to get that planning piece going.
Absolutely. Absolutely. Those are wonderful recommendations, wonderful resources. Denise, Jana, you've been wonderful guests on the show. We end each episode with the Golden Nugget segment. And I want to ask you our final question of the day. If you could share one piece of advice or one recommendation with practitioners, what would it be?
So I'll start with this one. We have alluded to some of these things already, but assessing handwriting skills through telehealth requires practice. As I mentioned before, we often sit beside a child whose handwriting skills we are assessing not across from them. So I would encourage anyone who's addressing handwriting skills through telehealth to practice just that. Make sure you know your assessments really well. Practice having a person sit across from you while you try to administer the tool so that you can determine if they're starting and doing the correct sequence of steps while you're sitting across from them. This will mimic what your session will be like online. Additionally, make sure you practice that virtual connection through your platform with another person before you start doing therapy sessions. You'll want to determine how your video feed looks to you and how it looks to the child. So if you're demonstrating how to write a letter, either through an air writing activity or even writing on a chalkboard or a piece of paper, you want to make sure that it is oriented correctly to them. So the settings keep changing as these platforms update and how you can mirror your view or do other things like that. You'll want to make sure you know what you need those settings to look like for them to see it correctly. Jana, what advice do you have for our listeners?
I think start small. I think that's good advice, that you don't have to just jump right in and do it all, but to start small, pick one child or a couple of children who you think would benefit. Perhaps, if it's a family who has to travel a long distance to a clinic, or maybe they don't have access, they just can't come to the clinic, they might be a great candidate to try telehealth. And, I think that once you personally see the benefits, you'll be more confident and more likely to want to continue to use telehealth in your OT practice.
Absolutely. Those are wonderful nuggets to conclude our interview. Jana, Denise, it's been such a pleasure for me to get to know you, to learn from you, and thank you so much for sharing your expertise with all of us today.
Thank you.
Thank you.
Thanks for listening to Everyday Evidence. Tune in next time for more evidence-based practice insights and applications.